My name is Erica Rogers, and I'm going to be speaking about bipolar disorder. This is my audience. Can you all see it?
See if it's recording. Yeah, that's getting us. It's getting everyone.
This is my visual aid. Okay. The majority of illnesses and diseases that kill people are related to cancer, heart disease, rare deadly illnesses, and the like. What a lot of people never consider is how dangerous and fragile the mind is. The mind, in connection with the brain, can cause a person just as much pain and suffering as any other part of the body. One mental illness in particular, called bipolar disorder, affects approximately 5.7 million Americans. In fact, according to the National Institute of Mental Health, bipolar disorder results in 9.2 years reduction in expected lifespan, and as many as 1 in 5 patients with bipolar disorder complete suicide. Bipolar disorder, also called manic depression or bipolar affective disorder, affects numerous people in a very serious way, and it is important to be aware of and educated about this prominent and crippling illness. Today we will discuss the symptoms of bipolar disorder, the potential causes of, and the various treatment options. Much of the information I'm going to share with you today came from pubmedhealth.org, psycheducation.org, pendulum.org, and health practitioner Barb Lozano. There are many symptoms of bipolar disorder, and it is a rather difficult disorder to diagnose. According to PubMed Health, there are 3 types of bipolar disorder. Bipolar disorder type 1, in which a person has at least one fully fledged manic episode with periods of major depression. Bipolar disorder type 2, in which a person never experiences full-fledged mania, but instead hypomania, which is less severe, also depression, and cyclothymania, an even milder form of hypomania and depression. Bipolar disorder consists of a level of mania and a level of depression. These are the symptoms of mania, which include agitation or irritation, noticeably elevated mood, lack of self-control, racing thoughts, poor temper control, reckless behavior. And these are the common symptoms of depression, which include eating disturbances, fatigue or listlessness, loss of self-esteem, persistent sadness, excessive sleepiness, or suicidal thoughts. An account from an anonymous sufferer showed what these symptoms look like in a severe case. He says, "Initially, I had days when I was intensely irritable with my family and suffered from episodes of anxiety and tension headaches. I put these down to the long hours I was working and full social life at the time. Then driving down a motorway one day, I decided it would be appropriate for me to crash the car and end my life. This was the start of very strong suicidal thoughts and impulses that would pop into my head unbidden and needed real mental energy to resist acting them out. This account, along with the severe symptoms I have just listed, make one wonder, what causes this life-altering illness? Doctors and scientists have not determined a singular or definite cause of bipolar disorder, yet there are extensive studies and evidence which show high correlation between bipolar disorder and genetic predisposition, thyroid problems, and various other factors. Scientists have proven that there is a direct correlation between this mental illness and genetic linkage. As pendulum.org points out, 80 to 90% of people diagnosed with bipolar disorder have family history of bipolar disorder or major depression. An observation of families has shown that children of one parent with bipolar disorder are 7 to 20 times more likely to have manic depression than children of parents who do not have bipolar disorder. A link exists, but that does not prove a bipolar gene. Another possible cause of bipolar disorder was recently discovered. Studies currently show a high correlation between the disorder and thyroid problems. A study done by the Altrex Center for Mental Health Care on over 200 bipolar patients and control groups shows thyroid failure was present in 17% of bipolar patients and more prevalent in women. Psycheducation.org commented on this study, concluding that there is a clear connection between the process of thyroid hormone regulation and bipolar disorder. Again, correlation is not proof and cannot be purely coincidental, but the studies seem to suggest a direct cause and effect. Psychologists have also determined several factors that may trigger bipolar disorder. According to PubMed Health, these factors can include stress, substance abuse, medication, seasonal change, and sleep deprivation. This serious illness, despite the cause, needs to be treated so that the affected individual can live their life to the full potential. There are many different ideas about treating this disorder, and I will not suggest that one is better than the other. I will simply describe several treatment options. There is conventional medicine, homeopathic remedies, and many levels of psychological therapy. The most common form of treatment is conventional medication. According to PubMed Health, there are several medications used to treat this illness. If one fails to take their medication correctly, there can be severe complications such as alcohol and/or drug abuse as a strategy to self-medicate, personal relationships, work, or finances suffer, or suicidal thoughts and behavior. Also, as a local health practitioner, Barb Lozano points out, medical drugs are oftentimes toxic. Read a few side effects of the most prescribed drugs for psychosis. Oftentimes they will say, beware of suicide. These drugs are helpful, but if they are incorrectly or even correctly sometimes, or even used correctly sometimes, they can have detrimental side effects. A second method of treating this disorder is by using homeopathic remedies. Barb Lozano favors this type of treatment because in health, the homeopathic and herbal remedies stimulate the body to heal itself by detoxing the causes and supporting the areas of weakness. This method is similar to using medication, except all the remedies are natural and produce virtually no side effects. The results are not as noticeable, but they do help treat this illness if used consistently over a long period of time. There are many different forms of psychological treatments, anything from talking to a therapist to transcranial magnetic stimulation. The type of treatment one should receive depends on the severity of their bipolar disorder. Receiving therapy and support can be very helpful for someone suffering with this illness because it can help them understand their illness, learn how to cope with it and treat it, watch for signs of relapse, and learn a healthy lifestyle. These are the various treatment options and should be discussed with a doctor to decide which option would help the patient most effectively and efficiently. In conclusion, this is a serious mental illness that is important to understand and be aware of its symptoms, its causes, and its treatments. Don't let bipolar disorder polarize you.
That was actually much better.